So there's kids who need, it's medically necessary for them to have anesthesia to do their dental treatment. They have to be asleep, to be comfortable, to be safe, for us to do a good job. And things that are going to last for them. And so there's a disconnect right now because dental insurance will pay for the dental, but dental insurance doesn't pay for the anesthesia in most
Insurance
cases.
Is a scam.
And so it's
really
just
bad.
so it's like it's just crazy. And so really most states, 34 states already have legislation in place where their medical insurance should pay for that procedure because it's medically necessary. So even though it's a dental procedure, it's still a medically necessary procedure that they need to have. But right now they don't. And so I have a kid, I go to Dell Children's once a month to treat really medically complex kids. And I had a kid who was waiting for heart surgery. Her cardiologist said, I need her dental work to be done before her heart surgery because if you have all these infections in your mouth, it affects your body, it affects your heart. And so like the success of the heart surgery will be reduced if her dental work doesn't get done because all this bacteria is infecting her whole body. So her cardiologist said this. I know she needs this. Her medical insurance would still not pay for the anesthesia.
That's insane.
And so there's just like, they said, oh, well, you're out of network because you're a dentist and like we're not paying for this. And so this kid, like they either have to wait for their heart surgery or they move forward with the surgery and then they risk like the surgery failing because they don't have it done. And so it's just like, it's really frustrating. It's not what's best for these kids. And it's, this is the care that they need and their medical insurance should pay for this. And so anyway, the Texas Academy of Pediatric Dentistry, the Texas Dental Association supported this legislation to move this forward. So I went to testify and, basically shared some of my stories that I've had with my patients. And so it passed in the health committee in the Senate, and then it passed in the full Senate last week too. And so now I'm actually going back on Wednesday and I'm going to testify for the House. And so then it's going to be in the House committee and then it'll be presented to the whole House. And then obviously if it passes everywhere and the governor passes it, then we'll be able to put this into law.